We did, however, find during our research that there were some particular issues that did cause concern for patients as well as the practice. We found that there were particular conditions that did seem to cause some distress, and in particular one of them was a termination of pregnancy. The typical scenario was where a grandmother, for instance, in her 60s, came in asking for access to her medical records, and she found out that in the medical record, 40 years previously, in her 20s perhaps, she may have had a termination of pregnancy for whatever reason. Following the termination, she may well have then gone on, found a partner, got married, perhaps had children, perhaps now has grandchildren, and nobody ever knew that 40 years ago she'd had a termination. Suddenly, she looks at her medical record, perhaps over the internet, or on disk, or on a computer screen, and realises that nobody knows about this termination of pregnancy, and what should she do now? Should she access it? If she is able to access her medical records, and one of her family members or friends were to find out that she'd had a termination, what might that do? We don't know the answers to that question, and I know that it's not for me as a doctor to make that final decision. It's important that we sit down with yourselves and talk through the issues and decide whether it's right for you. I've described a termination of pregnancy, but there may be some other condition, there may be some other illness that you don't want anyone else to know about, and it's important that you think through this before you put yourself forwards for records access and accessing your notes. It's impossible for us to know all the issues that may have happened. And remember, the way the human brain sometimes works, if there's something uncomfortable that you'd rather try and forget about, your brain itself will tend to take that piece of information and put it into the subconscious, hidden away, so that you've forgotten about it. If you're not sure what may or may not be in your medical record, you may be better off coming in and sitting down and discussing it with your doctor, having a look at the medical record in the presence of your GP, and then deciding whether you want to then have access to your full medical records over the internet.